In today's session, we are going to be talking about some fairly heavy stuff. So this is a bit of a health warning at the start, just to please look after yourself. We're here to share some learning, and so please be respectful, and appreciate the learning opportunities that we're going to be giving. As Nikki said, we are recording, so keep your cameras on if you're happy for that. If not, please keep your cameras off and keep your microphones on mute. We are going to do a bit of Q&A at the end, and there's opportunities for questions then, and the chat box is open, so please do pop any questions in the chat, and myself and Nikki will do our best to answer those as we go through today. So if I'm just going to introduce this topic this morning, I'm just going to spend 2 minutes talking about the Safeguarding Adults Partnership. Some of you will have heard of the partnership before, some of you will not. So for those of you that has heard it, this is a bit of a reminder. We are a statutory body sitting in Stockport. Every local authority in England must have a Safeguarding Adults Board or a partnership, and that is a collection of different agencies that work together to oversee statutory safeguarding responsibilities. So primarily we work with the local authority, NHS Greater Manchester and Greater Manchester Police, but we also do an awful lot of work with our other partners across Stockport NHS, Pennine Care, housing, probation, substance misuse, lots and lots of different services that work and have a safeguarding responsibility for adults with care and support needs who live in Stockport. We have a number of statutory functions on the left there. So we have to have a business plan, we have to have an annual report, and then we have to complete what are called safeguarding adults reviews. And that all sounds very abstract, but on a day-to-day basis, what does that actually mean? So myself and Nikki and our partners deliver lots of different training. We make sure that we've got the right policies and procedures in place. We do lots of work looking at audits and data. And really that is all done to make sure that we have and maintain and strengthen the right relationships across our partnership to make sure that we're all working together to safeguard adults in Stockport. I mentioned we had some priorities there. Those are the current 5 priorities for the partnership. So we've got a real focus and a real ambition at the minute over the next 3 years to improve partnership working and information sharing, making sure that young adults have effective transitions from childhood into adulthood. And as part of that, we understand and assess complex trauma and risk in the right way. Our children's counterpart has a particular focus on how they work with men, and on the adult side we really want to make sure that we make safeguarding personal, and that's a bit of a theme and a bit of language that you are going to hear as we talk through the slides this morning, that real concept of putting someone at the heart of what we do and how we make safeguarding personal. So what is a safeguarding adult review? That's all the stuff on the partnership, but really the meat on the bones, what is a safeguarding adult review and what are we going to be talking about this morning? These reviews happen in very particular circumstances, and we do them to get learning out of an incident. It's not about finding blame, it's not about finding fault, but we do these over a period of 6 to 12 months to see where we can learn and improve our systems and processes. They're very interactive, so we don't complete them in isolation. And as we talk this morning, we are going to talk about lots of different people that we've spoken to and worked with for Martin. Martin isn't this gentleman's real name. Some of you may recognize the person that we're talking about, but we always make sure our reviews are anonymous. And we do that for 2 reasons. First off, we want to make sure that we respect the identity of Martin and his family. And we want to make sure that we respect and protect any professionals that were involved with Martin. So we're not looking at going down a route of finding fault or blame or recognizing what went wrong, but we're really focusing on the learning and removing any of that information there so we don't get distracted with that. And we do that because we want to learn and we want to prevent similar issues from reoccurring in the future. All of our reports are published, so they're all on our website, and we will drop a link into this report in the chat and on email when you get a copy of these slides. And once we've done that, we'll be talking about learning points, and we want to test, we want to make sure that learning is real. So we want to make sure that it's been shared, embedded, and it's making a difference. And as myself, Nikki, and our guest speakers talk through this session, we are going to be talking about what would have happened if we saw Martin today and what differences that we've made as a system. I mentioned that these SARs can take place in particular circumstances. On the left there is the Care Act statutory guidance. I'm not going to talk through that, but I'm going to direct you to the text on the right-hand side that says, essentially, under the Care Act, we must complete a safeguarding adults review for an adult with care and support needs who has experienced abuse or neglect and we have concerns around that multi-agency working to prevent that abuse or neglect. And that can take place following either the death of that individual or a serious injury or accident. Sadly for Martin, we're going to be talking about number one. Martin died in February 23, but we are going to be talking through some of his care and support needs, his self-neglect, and that multi-agency response, so we can tick those lists off there. Before I hand over and I finish this part of the session, I just want to bring Martin to the heart of our conversation. So I want to introduce him as a person. I had the privilege of meeting Martin's family when we did this work, and they shared an awful lot of information about who he was, what he enjoyed, and what his likes and dislikes were. So Martin was 49 years old at the time of his death in February 2023, and he'd lived in Stockport since 2007. He'd grown up in another town in the northwest and moved across in his early 20s. Martin had a keen interest in live music, travelling, going on holiday with his family, and aeroplanes. He really used to enjoy going to Manchester Airport and watching takeoff and landing because he really enjoyed watching that aeroplane activity. Martin was the eldest of his siblings in his family. He had two younger brothers and a younger sister, and he received an awful lot of support from his siblings and his parents outside the wraparound support that professionals put in from a system perspective. And Martin lived in his own tenancy. He had support from services to make sure that he maintained his independence in his tenancy, but he did live independently with support there. So it's really important that we understand that there were aspects of Martin's life that were quite aspirational and quite strong, and there was some good practice around how we helped him to maintain his independence. I'm going to pass over to Nikki Chester now, who's going to talk through some of the learning work that we did around Martin.
Thanks, Jonathan, and really, thank you for setting the scene of who Martin was. Really important to capture that in this learning event. So what I'm going to talk about is how we actually got the learning. So we did a learning event way back when. It was quite a while ago now. Myself and Jonathan facilitated that event, and we had really good key colleagues at that event. With a range of different agencies. And the main part of the event, or one of the main parts, was framed with Martin's family views. So really important to capture the voice of Martin's family and to capture Martin's voice within this as well. Like Jonathan said, SARS are around looking at that good practice. We also did look at the missed opportunities, which were quite challenging within the event at times. And we did look at some of those challenges and gaps in service provision. I just want to kind of, look at the point again. It's not about apportioning blame onto any systems, any agencies. It was looking at the learning themes across the system and not across individual practice. So within the learning event, I said we had a number of agencies that were there with us, and those were the agencies with Martin in the heart of those. We had Adult Social Care, we had Martin's GP, we had the Prevention Alliance, Stockport Homes, our main housing provider. We had Westwood Home Care, who provided support and care to Martin. Pennine Care NHS Foundation Trust and our Stockport NHS Foundation Trust. So those were the people and the agencies who were involved in the learning event. And these are the concerns that were raised. You can see there, they're written down on the slide. And one of the concerns was Martin's increased alcohol consumption, and that was in the last 12 months before his death. We had a concern around his decline in mobility. And there were safeguarding concerns that were given to the local authority, and we will talk a little bit more about those. I know Julia Newton will talk about those as well. We did see that there was a rapid decline in the physical health between December 22 and 23. And Martin did show signs of that self-neglect. And again, we will talk about that in a little bit more in depth. We looked at the concern around the multi-agency working and different agencies sharing sharing information between each other, looking at the full picture of Martin, not having just little pieces of jigsaw, that we wanted that full picture with that sharing of information. And like Jonathan said, Sadly, Martin did pass away. He sadly died in February 23, and the cause of his death was noted as decompensated alcohol liver disease when agency had not effectively shared information or recognised his needs until shortly before his death. And that was from the record of the inquest. So we're going to look at now, really, I will labour this point about capturing the voice of Martin and his family. And like Jonathan said, he really did have the great opportunity to spend time with Martin's parents, which I know that Jonathan was really, really thrilled at being able to do that. And within this learning circle, I want to thank Martin's family for that. So what Martin's family, what his parents said is that they believed that his death was preventable, but they understood his self-neglect. They absolutely understood that fully. They were supportive of the learning event, so supportive of the learning around the SAR and the LEDA process. But what they would have liked is to see those processes more joined up and for that not to happen in silo. So for those of you who don't know what the LEDA process is, it's the Learning Disabilities Mortality Review, and that is the process within the NHS. And it looks at the lives and deaths of people with learning disabilities. And they look at how things can be improved, very similar to the SAR. But what Martin's family said is they would have liked to have seen those a little bit more joined up. They didn't believe that his care plans were as joined up as they could be. And they didn't always think that professionals understood Martin, that they understood how he listened, how he took things on board, how really people needed to go over things with Martin for him to be able to understand them and to retain that information as well. And what they said was that they would have liked to have had more involvement in his healthcare. Jonathan mentioned, yes, they did have a lot of involvement within his life, as his siblings did. But what they noticed is that they would have liked more involvement in his healthcare. So we're now going to look at some of what we learned within the event. And this is what we learned from the professionals within the room. There was some really great good practice, and it was shown with interventions from Adult Social Care and Stockport NHS Foundation Trust, and that was where they rapidly put support in place at the end of Martin's life. But some of the good practice we saw that Martin did lead a really independent life, and we saw some of that through some of the support networks. These are the missed opportunities that we found within the learning event, and colleagues really did take the narrative around the missed opportunities on board. And I've said before about the self-neglect. At that time, we saw that there was no formal Section 42 safeguarding process initiated around the self-neglect. I'm not going to go into that any further because Julia will talk about that. But it did show that there was the lack of that information sharing, so that information sharing between agencies. There were issues around how health staff were able to access Martin's hospital passport, and that was from his previous episodes within the hospital. And I know we have got colleagues from Stockport NHS Foundation Trust who will speak about the hospital passport in a few slides. Failed home visits, they were not always followed through or escalated, and the end of life service not utilised, and that was due to the time frame regarding Martin's death. We all know the concerns that we had around COVID-19 and lockdown, and the support that was suspended for our really most vulnerable people. And Martin we found that was the missed opportunity within Martin as well. There were clear signs of severe alcohol usage, and these signs, they weren't always raised by services. And because they weren't always raised, those concerns were not addressed with Martin. The concerns were not addressed with his family. And like I said before, Martin's family were not fully included in his care planning. So we have learning around that, around how professionals can work with adults who have capacity. So we looked at the professional learning, but we thought what it was really important to do was look at the learning points from the family. And those learning points from the families, I have touched on a couple of them so far, but what they said was that emotions were really hard for Martin, that he wasn't always fully understood. And they felt that professionals didn't know how to work with Martin, and that they didn't share, that information like we've discussed before. They said that he was kind of set up to fail with his employment, because the reason they said that is that people didn't revisit the learning with Martin. They didn't revisit tasks with him. And we looked at people with similar learning disabilities, as they can't retain this information. Excuse me. What Martin's family said is that he was not always, they were not always kept informed of changes within, those changes within support workers, within his assessments, within his care package. And they felt that they weren't told as much as they could have been about Martin. And again, going back to that information sharing, when people were deemed to have capacity, which Martin was. There's just one point from Martin's brother, one of Martin's siblings, and he said that the main issue was the cut-off of support hours. He said that Martin kind of lacked that stimulation and activities. Martin's brother did mention again about the changes in support work, and he did recognise, one of his thoughts and the learning for the event was that there was no support around his hygiene, around that self-neglect part within Martin. So from that, we came up with some learning themes, and we came up with 5 learning themes. And we were really, really grateful to have the voice of the family of Martin, because we don't always get that with Safeguarding Adult Reviews, but we were really grateful to get the voice of the family. As you can see there, the learning point 1 was that not all agencies within the Safeguarding Adult Partnership are aware of support that's available within learning disabilities within Stockport. And we'll see that information, we'll see some information being shared within our learning disability team later on. Learning point 2 is that agencies working with adults with learning disabilities should review processes for maintaining that hospital passport. And that is, if somebody is presented within hospital, that hospital passport, to be there with them, to be present. And we'll, like I said, we will hear from Stockport NHS Foundation Trust about that. Learning point 3 is looking at how those professionals engage with a wider network when working with adults with learning disabilities. An adult learning point 4, I'm not going to really go into this, because Julia, as I said, will talk about that in her section. Learning point 5, we looked at how professionals looked at the consistency of that engagement when vulnerable people were not allowing those professionals into the homes. So it's how we look at that engagement, how we look outside the box on how we can engage vulnerable people, and how we can include the escalating concerns where appropriate. So those are the learning points pulled together, and we will talk about the outcomes of some of those learning points now.
Hi, my name's Emma, and I'm the service manager for our learning disability team, and I'm going to talk to you about a little bit about our team and what we do, and then Julia will talk further about adult social care. So first, I thought it'd be useful for us to kind of define really what is a learning disability. So the Department for Health and Social Care defines a learning disability as a significantly reduced ability to understand new or complex information, to learn new skills with a reduced ability to cope independently, which started before adulthood. And that's different than somebody who's maybe got dyslexia or dyscalculia, which would be a learning difficulty. And just part of our learning as well, when we've developed our learning disability strategy, we really thought about those things, and if you want to access that strategy, it's online. We've launched it this week. So the Learning Disability Social Care team is co-located with our health team. We've got 12 full-time equivalent social workers, and we work with people with learning disabilities who are ordinarily resident in Stockport. We work under the Care Act, completing a needs assessment or carers assessments where they're needed. And our focus is on ensuring that people with learning disabilities can live as independently as possible, with a focus on supporting people into work wherever possible. And our social workers also work under the Professional Capabilities Framework for people with learning disabilities, which is a specific framework which supports us to make sure we're doing right by people with learning disabilities. So if we were to meet Martin now, we recognise that the support and the induction for the worker who was supporting Martin could have been improved. So we've now got a more robust induction offer, including shadowing, training, supervisions, and making sure that that really is thinking about what does that worker need to really start their journey with us here in Stockport well, and so that they can support our Stockport residents in the best way. In the team, we've got a much better awareness of self-neglect and collecting within the social work team. And our social workers and managers within the team have spent time understanding and embedding the self-neglect policy. We've got peer review running in the team as well, which primarily one of its functions is around quality and assurance. However, it is a space where social workers can bring situations and people that they're working with to say, I'm working with this person, how best, am I missing something? There's something not quite right. What, does anybody know anything that can help me or the person I'm working with really get the best for this person? Viaduct, who support our learning disability health checks in our GP surgeries, we're now attending their team meetings to support that link and making sure that we're all connected. And again, if we were to meet Martin now, I think the importance of professional curiosity can't be undermined, really. That it really is so important, that kind of professional curiosity and making sure that workers feel they've got the space to be professionally curious. So we are looking at the share model, and each team's got a copy of their own book, and we are thinking about how do we give people more time and space to understand what this model is. But really it's about, what do you see when you're meeting with somebody? What do you hear? What action do you need to take? Reading some, actually, is there something that you need to learn a bit more about, or is there a policy or something that can support you in your practice? And then with all of that, evaluating it and kind of thinking about next steps to support that person and really keeping that person at the heart of what we're doing. So it might be that somebody comes and they maybe look a bit more unkempt than they normally do, and really just kind of thinking about those things and asking those questions just to make sure that we're understanding what life is like for the people that we're working with, and that we're able to offer them the support that they need.
Hi, so I'm Julia Newton. I'm the Principal Social Worker for Adult Social Care, and I have a Head of Safeguarding and DOLS role as well. So following on from what Emma said, we've really been challenging ourselves in relation to what support are we giving and direction are we giving to our practitioners? How do we strengthen our professional curiosity, but also how are we clear about our expectations in relation to practice? So there's a lot been going on across the service. So we've now got a practice framework that really pushes relational practice, that bit about really understanding the person and their networks, and ensuring that we are making sure that we're really getting to know that person. We're talking about gloriously ordinary lives, and really challenging ourselves around our offer to people. And you know, when you think about the feedback from Martin's family, it was that bit about, did we really know Martin? Did we because he was more independent than a lot of people within the LD team, and we have to stress that he wasn't living in a supported tendency, he was living independently, which is really positive. But what it meant was that when we did actually go and visit, etc., that we really made sure that we had that space and time, and we observed what was going on. So one of the things for me as well was that in his health records, he actually stopped having some support from the LD health team because his drinking had improved. So that's what we were going off. And yet when we looked at some photographs as part of this review, there was clear evidence in that property that he was drinking heavily. So why had that not been explored? Why had that referral not gone back to the health team to say, you said he was improving, but actually we're seeing bottles all around the property, etc. So, you know, some of that isn't rocket science, is it, about seeing what just because you've read it's getting better, but if you're going out and seeing something, then you need to be doing something about that and supporting. Because was Martin having the right offer to explain to him about the impact that was having on his health, etc., and what that might lead to? So when we're managing those risks and bringing the right professionals in to have those conversations. So we've got a practice guide now that we've launched around professional curiosity and making decisions. We're also working with people to find out what really matters to them. So we've actually developed a charter that's on here as well, the Adult Social Care Charter, and people are basically saying it's really important that you're promoting my independence, but you're really listening to me and you're being honest and personal to me. So we're really making sure we're taking that feedback, and we are supporting our practitioners with this as well to make sure that they've got the right guidance and support. And the share model is another area of practice development that we're looking at to strengthen our support for our staff. So some of the things that we've done, so we mentioned that there's been a bit of a delay since the learning review, and thanks to everybody who was part of that learning review. And I just wanted to share a reflection really about that learning review. There has been a delay, and that's because we've had we wanted to make sure that we've had that full engagement from the family, and unfortunately that's not always been straightforward. But at that learning review, I know that some of our staff attended, and we really made sure we got people from right across the system. So thanks to people who joined us. But our team were really apprehensive about attending that learning review, and they didn't tell me till afterwards. But actually they got a lot out of attending the learning review. So I just wanted to emphasise, if you are asked to be part of a learning review under the SAR process, please don't fear it. It isn't about apportioning blame, as we mentioned earlier. Embrace it, because this is about how do we improve our offer to people moving forward. And whilst there's been the delay, it hasn't meant that we haven't made changes already. So one of the key things for me that came out of Martin's case is that we hadn't put his case under the Section 42 process. So what we'd done was we might have been supporting him, and I'm not saying people, and this was probably practice right across adult social care, where we were seeing or believing there may be possible self-neglect. A lot of that was being managed under our case management process. And what that meant was that it wasn't really giving it that real focus around that multi-agency working, because there's something about putting, at least for the initial sort of protection planning and scoping out of any work that needs to happen around somebody that's self-neglecting. If we put it under that Section 42 process, that then puts a duty to make sure we're information sharing with partners, we're getting the right MDT approach, and unfortunately that hadn't happened with Martin. But what that means for me as well was when I was looking at the data for Stockport, our self-neglect looked really low. The prevalence was really low. And I knew that wasn't really what our staff were experiencing or seeing. So that meant that we weren't getting that intelligence about how much of an issue is self-neglect across our system. And therefore, that becomes really difficult then about saying, actually, we need to look at providing different services. We might need to commission things differently, but we didn't have the data to have that sort of conversation. So the the reason and the work that we've done to really push to make sure when people are actually you know, believing that somebody might be self-neglecting, the reason that I'm asking our staff to put that under the Section 42 process is twofold. It is for ensuring that we're getting the right MDT approach for that person and a better outcome and sharing that approach. But like I say, that isn't necessary for the length of time that they're working with somebody around self-neglect. I think it's for that initial protection planning, because we don't want safeguardings that are open for 12 months, which some people might be open for that length of time given the work that we're doing. We want a timely sort of approach and keep it open while there's an action plan. But the other aspect was also to make sure that we're getting the right data to then be able to have more preventative upscale sort of conversations with our system to say that we might need to be looking to do something differently to support this area of work. So since we've done that, and since this was as a direct result of Martin's SAR, we've got three times the amount of self-neglect cases now being captured, and we are in line with the Northwest average. So that has really improved, and I want it to continue. And whilst I have to then justify to our leaders and the head of the council that we're seeing, you know, an increase, I'm trying to also say that that is because we've changed our practice rather than it actually becoming a much bigger concern in Stockport as well. But I'd rather us be able to evidence the extent of some of those issues as well. And I also chair the Quality Assurance Partnership under the Safeguarding Partnership, and the Quality Assurance Partnership recognised that self-neglect was an area of work that we really needed to do some work on and focus on. So we've actually run a self-neglect audit as well following Martin's SAR that some of you supported, that was right across the system and had really good attendance, and there was some real energy around how can we work differently with people to improve their outcomes. And as a result of that, we've got an action plan that we're going to join up with the action plan for Martin. So I suppose when we're doing these sort of SARs, we really need to track that learning and to see that change is actually implemented. So we're going to join those two you know, action plans up to follow up with evidence, and part of that we are going to refine that self-neglect guide and toolkit so it's easier for staff to and relaunch it as well. So thank you for letting me share that.
Thanks, Julia, and thanks, Emma, for that. So the next topic that we wanted to cover this morning was around substance misuse. That was a big feature in Martin's SAR. So Martin was referred into the START service, which is the local point of access for residents who are aged 26 years older and have consented and are engaging in that support to seek help with their substance misuse. There's information on this slide there. When they come out, you'll have access to those referral links in the bottom. But what's really important is for Martin, we were really interested in how he was supported to access substance misuse information, services, referrals, appointments, given his learning disability and given what we know around adults with LD. So one of the differences between practice at the time and practice now, building on what Julia said, it's around the MDT approach. So previously, Martin would have had to have been referred through our MARS process, through our team on the adult process, which wouldn't have always resulted in the right level of information sharing and the right support for Martin as a wraparound there. That's completely changed now, and Martin wouldn't necessarily need that team on the adult meeting to result in that referral. And there are changes, further changes happening across the system to make information more accessible for adults with learning disabilities. So that was just a bit of information on the substance misuse service there. The next subject that we want to talk about is Pennine Care NHS Foundation Trust's Community Learning Disability Team. And I know we've got Julie on the call, who I'm going to invite just in a minute. But just to introduce this service, they are open for anyone aged over 18 who has a learning disability and has access to a Stockport or is registered with a Stockport GP, and that service is there to reduce health inequalities and support to individuals to access mainstream services. So you can see at the bottom of the slide there lots and lots of different professionals that work within that service, and that's about giving the right level of support at the right time to kind of help individuals like Martin to access the services that they would need. Lots and lots of different pathways that are offered through that service. So physical health, access to treatment, treating some of those health inequalities, positive behaviour support, physiotherapy, mental health and LD, but just making sure that that kind of right offer is in the right way at the right time. And we were really keen in unpicking that for Martin, because his parents mentioned they felt he was sometimes set up to fail and we didn't understand the complexity of the person we were working with. So we're really interested when we did the learning event, when we did the SAR, just to understand what had happened there. So like I said, there's referral information there if you wanted to make a referral into that service. But the real key and the real crux of this, again, is if Martin was referred into this service now, what would be different? And really what we heard and what we learned is that idea of early intervention and that early level of support. So if Martin was referred now, he would be supported to access specialist services such as substance misuse, like we talked about there, and really supporting him to get the help that he needs and understand and unpick some of that. One thing that has also changed is that service in Pennine now also has primary care assistant practitioners. And if that had been in place when Martin was there, and that's a change that's happened since, they could have facilitated Martin to attend his annual health check, get that physical health issue understood and addressed, and get that early intervention there. Julie, I know I'm putting you on the spot here this morning. Is there anything you wanted to add? Because I know you're kind of a key part of that service.
So I've only been asked this morning, but I was told it would be useful if I provided sort of like an overview of what we would do within the Learning Disability Health team if we got a referral with Martin's needs. So the first thing that we would do would be to do a triage assessment, whereby we would have an initial meeting with Martin and with all the relevant parties, just to see whether or not we feel that the referral was pertinent, and that if we had any actions identified from it. I think from this scenario, we would accept Martin and initially start off on the physical health pathway. We will be looking to do a healthcare assessment, which is basically it's a health MOT for people with learning disabilities, and that covers everything from eye tests to whether someone is concerned about sepsis, the full MOT. Part of that would be about a big part of that is in connection to the primary healthcare practitioners. We will be looking about whether or not the person has had an LD annual health check. And following on from that, the GPs would be expected to develop a health action plan. And the role of the primary care assistant practitioners is very bespoke in terms of looking at accessing annual supporting people that have a limited uptake of annual health checks. But we would look at the annual health check as in a broader sense as part of the healthcare assessment. Another key section within that, I know it's been touched on, is about whether or not the person has hospital passport. And I think, do I need to talk about what that is, or will that be spoken about later on?
No, Julie, I'm going to cover that in the next slide. So,
right, okay.
So that's great. Thank you.
So in terms of doing healthcare assessment, we will be picking up one of the sections would be about picking up substance misuse. And in this case, we certainly, if it was felt required, we'd be looking into the drugs and alcohol team, which is a START service. We'd be linking in with the mental health services. We'd be linking in with GPs. And we would be supporting Martin to access these services with the use of reasonable adjustments. We recognise that the START team are the experts, but we would be supporting Martin and that service in terms of looking at reasonable adjustments. So that may be things like extended appointments. It may be that a home visit is required rather than going into the clinic. It may be an extended appointment or in a quieter facility if the person did go into the clinic setting. And we would certainly be looking to work in partnership with all the relevant parties. So that would be Martin himself, it would be his family, it would be the staff team, the providers, adult social care, and maybe about pulling it all together, the wider generic services, pulling it all together into a good MDT working and effective communication. It sounds like, from what I don't know this case, but it sounds like that was missing, really, that full MDT working approach. And if it was relevant, we would be looking to develop some form of support guidance, whether that would be along the lines of a positive behavioural support plan or just general staff guidance. We would maybe be looking at developing a risk management plan, a risk mitigation plan. So I think if we're starting at it from scratch, they were the things that I would be wanting to be looked at. Is there anything else that you wanted me to talk about?
No, that's brilliant, Julie. Thanks so much for stepping in and sharing that from Penning's perspective. Really, really helpful. I'm going to pass over to Nikki now to cover some information from Stockport NHS Foundation Trust.
Thanks, Jonathan. And thank you to Lee Wolfe, who's the named professional for adult safeguarding within the Stockport NHS Foundation Trust, for providing us with this information. So what we're going to look at is the importance of appropriate care planning upon admission, looking at the Trust standard operational processes, and looking at the role of the safeguarding team to ensure the compliance around hospital passports. I know Julie's just touched on those, so thank you, Julie. And we did mention it in our learning point. So when the Trust is supporting patients with a learning disability, they go through various different steps, and with that step 1, they'll have a notification, and that notification is sent to the adult safeguarding inbox. What the safeguarding team will do then in relation to step 2, and this is completed within 24 hours, they will attend the wards, they will make sure that hospital passport is there. They'll look to see if there's any reasonable adjustments that need to happen within the care plan, and they'll consider whether that DOLS needs to be in place if appropriate, that deprivation of liberty safeguard. What they do have for patients with learning disability is the blue butterfly symbol, and that is displayed over the bed when somebody presents with a learning disability. And to look at that compliance around hospital passports, the adult safeguarding team will visit the ward to verify that step 2 has taken place. So to verify that the hospital passport and those other things that I've just explained are in place. And they'll make sure that compliance is recorded onto a database, so onto the Safeguarding Adult Learning Disability database. They will see if there are any outstanding actions, and if those outstanding actions are identified, they will look at do a follow-up visit the following day. And if there are any issues, those issues will be escalated to the ward matron. If there is any issues or there are any outstanding actions identified, and if the steps remained incomplete, they will record it on what they call their DATEX system, and that's on their 3rd visit. But what Lee tells us is that they have a 95% overall compliance in relation to hospital passports, with the remaining 5 likely due to the patient has been discharged from hospital, or the patient has sadly passed away whilst in hospital. And they really do look at that evaluation, that monitoring and that reporting. And as you can see there, they update the database by the end of the week. They look at weekly monitoring. They have monthly staff meetings. They share monthly meetings within each division. And they have that bi-monthly analyst, and that is into the Trust integrated safeguarding groups. So just to look now on some of their achievements, which are absolutely amazing and fantastic. Their Oliver McGowan training, the mandatory training, is virtually 95% compliant. I'm just going to pick some of the things here as I am mindful of time. They have accessible interpreter service posters, so they have them on patient whiteboards. They've also got the learning disability information packs, and they have done an easy read leaflet which is distributed trust-wide. And one of the things I really love from this slide is I think Amy's on the call. Amy was able to get the Makaton Choir into the hospital, who performed throughout the Learning Disability Awareness Week. So loads of really good positive feedback there. Yeah, really good feedback. What Lee tells us is that there is attendance at the Value in People Partnership Board, and they do attend the care provider forums, and that is to look at that positive working relationship with other agencies. Looking at their priorities, they have got a few priorities there, and one of the priorities is that key learning disability and autism awareness training. They want to increase that, although it is, you know, it is good already. Providing those reasonable adjustments to improve patient care. They have regular engagement with Healthwatch within Stockport, and they do participate in the NHS England Learning Disabilities Improvement Standards and the Year 7 audit. If Lee was here, he would be able to kind of expand on that, but it's a really good thing that they do participate. And they're continuing to look at the LEDA process that I explained before, and the notifications and the governance around that process. The Trust web page is in progress, and that's for patients with learning disabilities or autism. And what they're looking at is to providing virtual hospital tours, which is really great for, you know, if somebody is going to be going into hospital with a learning disability, they have the option to have one of those virtual tours. Ongoing efforts, they're looking at enhancing the training, like we've said, and looking at improved or other accessibility for people with learning disabilities and autism. So really great priorities there. And I think on the next page is we're just going to show you what the Blue Butterfly looks like, what the health passport looks like, and what that care plan for those reasonable adjustments. So they're just things that are quite visual for you to see what the things that the hospital are doing. So anybody got, I know we've got 5 minutes left. Anybody got any questions for any of our speakers on the call today? Is there anything in the chat, Jonathan? Because I couldn't see. Oh. So Julie's put, should have mentioned, in absence of LD liaison post at hospital, the LD nurses team can offer support with liaison and coordination of support for patients with learning disabilities in conjunction with safeguarding team. Oh, thank you for adding that, Julie. Really important. Hayley, got your hand up.
Yeah, hi everyone. I just wanted to say that hearing about Martin from the family and the experiences, it does make it real. So you're not then dealing with just a case, are you? You know that person, and I think that is really, really important.